All right, good afternoon, everyone. My name is Hector Perez. I am a program coordinator here at ADAPT. We are under Family Connections, which is a nonprofit organization located in the city of East Orange. Thank you so much for tuning into our program on mental health, which is titled Mental Health 1 Year Later. We have two phenomenal speakers with us today. The first is Ms. Laverne Williams. Ms. Williams is the Director of Promoting Emotional Wellness and Spirituality programs at the Mental Health Association in New Jersey. Thank you so much, Ms. Williams, for being part of the program. We also have Ms. Eileen Fishman, and she will be speaking during the second part of the program. So I'm going to turn it over to my co-host Alexis, who's going to explain more about what ADAPT does and our initiatives and some of our core values here at Family Connections. Alexis?
Hello, everyone. My name is Alexis Raymond. I am ADAPT Prevention Specialist. I just wanted to give a warm welcome to Ms. Laverne Williams and to our director, Ms. Eileen Fishman. Thank you so much for joining us today. Just a little bit about myself. I work alongside Hector Perez. I work with the Pain Management and Prescription Medication Initiatives for older adults. I also work with the college initiatives that we have upcoming for all colleges throughout Essex County. Just a little bit about our core values. So with Family Connections ADAPT, so we definitely really strive to make sure that we are inclusive to all communities. And the way that we do that, we maximize our impact throughout Essex County through the connections that we build with every community that we are creating programs for. So just a little bit about the initiatives that we have. So we have a interfaith initiative where we do webinars, discussions, roundtable events, and we talk about substance abuse. And then we also have our underage drinking and prescription drug abuse for youth. Also, I just wanted to mention, so for our mental health workshop that we have today, it is the introduction for our big virtual WISE program that we have coming up. That'll be for 6 weeks that we are offering in Spanish and in English, a little bit about what you'll be learning from that. You're going to learn about aging, health, substance abuse, and much more. And we really wanted to make it a space for seniors to come and to feel welcome and for us to learn a bit more about you, but for you to learn a bit more about us as well. So that's going to take place. The Spanish session is going to be the second week of May. That's going to be May 10th from 1 to 2 p.m. And then the English portion is going to be on May 12th from 1 to 2 p.m. as well. Hector?
Don't forget, Alexa, we also have free giveaways for our WISE program. Each week, for 6 weeks, we'll be giving some little knickknacks for those who participate, so make sure you sign up. We also have the DEA Take Back Day, which is coming up on April 24th. It'll be an opportunity for those who want to dispose of their unused or expired prescription drug medications to dispose of them properly in one of the many drop-off boxes located within the county. To find your nearest drop-off box, you can go on the DEA website or visit our social media pages, our website. Our social media pages include Facebook, which is Essex ADAPT, our Instagram page, which is essex.adapt, and our website, which is essexadapt.org. So make sure you go follow us, sign up for our newsletter, and stay up to date with the resources that we are providing and some of the other program initiatives that we're working on. So we thank you all for being with us again. The purpose of this program is to speak about the importance of mental health, in particular for our senior citizens. As we know, we are still in a global pandemic, even though the vaccination process has rolled out and it's being implemented nationwide. We still understand that many people are suffering emotionally, mentally, and physically. Our mental health is important. Therefore, it's important that we understand ways to stay positive, understand ways that we can, teach to other people, in particular to our senior citizens, who are one of the most vulnerable populations within the county, within the nation as well. This is also in anticipation for Mental Health Awareness Month, which is next month. So I'm going to turn it over to Ms. Williams, who's going to speak to us a little bit more about her work and her years of experience in the fields. So Ms. Williams, thank you.
Thank you, Hector. And thank you, Alexis, for inviting me. It's my pleasure to be here. I'm going to start and share my screen. I have a few things to talk to you about, and then I'm going to get out of your way. Okay, so this presentation is entitled Emotional Wellness for Seniors During the COVID-19 Pandemic. I am Laverne Williams, and yes, I am the director of the PEWS program, and PEWS stands for Promoting Emotional Wellness and Spirituality from the Mental Health Association in New Jersey. Well, who are we? The Mental Health Association in New Jersey, we strive for children and adults to achieve mental health through advocacy, education, training, and the services we provide. Just so you know, during the COVID-19 pandemic, your mental health is absolutely vital. So for free emotional support from our trained staff, all you need to do is call 866-202-4357 or 866-202-HELP. We are our multilingual service providers, or if you're savvy enough, you can text New Jersey Hope to 51684. We are open 7 days a week, 8 a.m. to 8 p.m., where you will talk to a live clinician. And if you want to stay anonymous and not give your name, that's perfectly okay too. And please do, ladies and gentlemen, visit our website, which is mhanj.org. It's free. Did I say it was free? And it's private. It's for persons 14 and older. We have a live chat. We have live texting. We have crisis counseling available if you so need it. And you can also take a screening. We have Zooms all day, 7 days a week. Check out a Zoom anytime you like. You don't have to have an emotional challenge to be able to get on the Zoom. Just avail yourself of all the information we have available for you. And I want to give a shameless plug to the program that I promote every Tuesday at 2 o'clock. It's called Thankful Tuesdays with Deacon Laverne S. Williams, who I will be your host. And what is the PEWS program? The PEWS program was developed to educate clergy, lay leaders, and faith communities so that they may more effectively support congregants who have or may be at risk of having a mental illness. With that being said, pastors and lay leaders will then be better equipped to refer congregants to appropriate services, and hopefully ultimately linkage to mental health services will increase. Get the information that you need. So bottom line, let's begin. So what are emotional challenges? And I need you to think about that for a minute. Okay. Well, emotional challenges are the terms that refer collectively to all mental disorders. And mental disorders are health conditions which are characterized by changes in the way you think, your mood, and your behavior. So when people hear the term mental health, some people only think about the illness. However, mental health encompasses far more than mental illness or even the absence of a mental illness. Mental health also means emotional wellness. I like to say emotional wellness because oftentimes we say the word mental, people conjure up the idea of someone who they've seen on the news who may not be taking their medication or not very well, and that's not the average person. But when we speak of happiness, peace of mind, enjoyment, or satisfaction, we're usually talking about emotional wellness. Having said that, I'd like you to take a look at this quick video, and then I'll give you some thoughts about it afterwards.
Our brains control how we act in the world, but did you know the world around us also affects our brains? Our genes, environment, and social interactions all work together to shape the way our brains develop. Sometimes these factors combine in ways that create unhealthy thoughts or feelings. Over time, these unhealthy thoughts and feelings become so unmanageable that we need outside support to get better. 50% of people will develop at least one mental health condition during their lifetime, and half of those people will develop a mental health condition by age 14. Unfortunately, it takes about 10 years for people to get the treatment they need. We don't wait to treat health problems like heart disease or cancer until stage 4. We shouldn't wait to take care of our mental health. The right early treatment can change lives, reducing school dropout rates, hospitalization, incarceration, and unemployment. Imagine what the world would look like if we all got the help we needed when we first started showing the early warning signs. Start the conversation before stage 4. Visit mentalhealthamerica.net to get informed, take an online screening, and better understand your own mental health.
Okay, so I'm going to ask you, Hector and/or Alexa,
Alexis.
what was the takeaway from that video? Anything that stood out for you?
To me in particular, it is important to, begin the conversation with, since we're talking about seniors in particular, to at least have the conversation about where do you think your mental health is at this stage in your life? What do you feel like you have any issues that are unresolved that, you may not necessarily see them as a big problem, but later on down the line could turn into a big problem. And, we, in our society, we have a lot of, negative stigma when it comes to just even the word mental health, because many people think associated with labels such as crazy or a lot of negative connotation, but that's not the case. So it's important to have the accurate information and share that along with people.
Well said. Alexis, you want to tune in?
Most definitely. So a little bit about the video that really stuck out to me was about how oftentimes we kind of put our mental health on the back burner and we don't actually pay attention to how we're really feeling, because at times we'll get caught up in just going through the motions of life. And, rather than like, if we had a physical sickness that we know, all right, we need a doctor right away. But our mental health, we need to take that into the same consideration. Just as if it was just something physical we were going through, we need to make sure that our mental, like our emotional, spiritual, all of that is intact.
Excellent. Both of you, well said. Appreciate that. And what stuck out for me actually was the fact that people will wait 10 years sometimes before they do anything about their emotional wellness. But imagine walking around with a broken arm for 10 years and saying, my arm doesn't feel right. Maybe I better go check it out. So why do we wait? Our mind, there is no help without mental health. So keep that in mind.
I like that.
Okay. So I'm going to do a quick true or false, just something you think about.
We're playing a game.
Higher suicide rate among older adults than young adults. What do you think? True or false? True, you think?
I would say false.
False.
I would say false.
Okay. Good answer. Suicide is more common among older adults than any other age group. Actually, 15% of all severely depressed individuals end up committing suicide. So that's a statistic that you need to be aware of.
Wow.
So the bottom line, attempts of talk of suicide by older adults or by anyone must always be taken seriously. And why are some of those reasons? Because sometimes persons have medical and physical problems, or they have loss of a lot of loved ones. The children have moved away and there's limited contact. There's changing roles. People are beginning to feel less productive. They may be taking care of a loved one or a spouse. Increasing dependence on others. Perhaps you've lost your driver's license and now you have to depend on someone else to get you where you need to go. And maybe you're not able to do the things that you used to do. And then again, if you are a senior and you're on Social Security, if you're used to having a check every week, that financial concern, just getting a check once a month could be a challenge. All right, true or false? Dementia is a normal part of the aging process. What do you think?
False.
False.
Okay. Very good. Dementia, it may occur in individuals as part of the aging process, but it's not normal. Does it happen? Absolutely, but it's not normal. Just not everybody doesn't end up wearing eyeglasses for poor eyesight. So again, my mom was 92 at life's end and she could read without her glasses and everything. So, and also speaking of dementia, she has some health challenges, but her mind was sharp as a tack. And every time I would visit her, because she was around the corner from where I worked, I would go in her room. The first thing she would say to me is, "Did you bring that $5 like you borrowed from me?" Wasn't nothing wrong with her mind. She was sharp.
Yes.
So what are some of those symptoms? Well, it's depending on the cause, type, and severity, and people may experience any or all of the following symptoms, such as struggles with problem solving or decision making, maybe having difficulty planning and carrying out tasks, problems with memory and recognizing familiar people, places, and things, maybe disorientation to a type of time and place, and decline in self-care, difficulty learning or retaining information. Some others are behavioral and mood changes, and then impulsiveness and maybe poor insight into their behaviors, not recognizing what's really going on. Just some of the signs and symptoms. And keep in mind that as bodies age, they need specialized attention. Older bodies undergo metabolic changes and muscle to fat ratio changes that affect the way medications work. So oftentimes I've heard persons say, well, my medications may not be doing the same thing it used to because maybe your body has changed. And with that being said, you should always seek help when you need to, whether it's physical or mental. And a quick question, what is the difference between a sign and a symptom? A sign and a symptom.
So a sign is something that you're looking for physically, and a symptom is something you're experiencing internally.
Excellent. I like that. And here's the down and dirty. A sign is what you see and a symptom is what you feel.
Ah.
Alexis, and I'll give you some of the signs. Perhaps again, decline in self-care, repetitiveness, lack of energy, sleeping too much or too little, or overeating or loss of appetite, and sometimes weight gain or loss. These are some of the signs. And some symptoms could be changes in your sleep and appetite, struggling with problem solving and decision making, problems with memory, recognition of familiar people, places, and things, and then sometimes fear, suspicion, and paranoia. All of these things are considered a symptom. And what are some common types of emotional disorders? You have anxiety disorders, which is the #1 in America, ladies and gentlemen. Mood disorders, schizophrenia, dementia. I can't see that. The next bullet, can you see that? My screen is in the way.
Schizophrenia? No.
Schizophrenia, next one.
Dementia?
Eating disorders.
Dementia, okay, eating disorders. So those are the top 5 common types of emotional disorders. Now, I'd like to, this slide really depicts, I get the question all the time, well, how do I know if it's depression or how do I know if it's the blues? Well, when it's depression, it's probably an illness where you will have multiple symptoms, whereas when it's the blues, it could be a normal reaction to life. Life happens, and you probably just only have a singular symptom. When it's depression, it's something that will probably persist, possible suicidal thoughts, and specific medications and/or behavioral treatment will be needed. When it's the blues, it's probably temporary. Suicidal thoughts are rare. Oftentimes, people just need somebody to be a good listener and time to heal. So that's the down and dirty of depression versus the blues, because sometimes people get confused. And having said that, a little bit more about anxiety. An anxiety disorder differs from the normal stress and anxiety, because we all get stress and anxiety depending on what's happening in our lives. An anxiety disorder is more severe and it lasts longer and it interferes with your daily activities and your relationships. So what I like to say, if it interferes with the 4 L's, you're living, you're loving, you're laughing, and you're learning. That's how you know. If you cannot no longer live the way you wanted to live or used to, love the way you used to, laugh the way you used to, think about it. When is the last time you really had a gut-wrenching laugh? Or if it interrupts your learning, the 4 L's, if any of those things are present where you cannot resume your normal daily activities, you probably should seek some professional help.
So Ms. Williams, just to add to that, and we just had a question for you. We wanted to know from your perspective, how important is it for our senior citizens to participate in activities that'll lead to a healthier mindset and their overall mental health?
Yes, and I'm going to get to that as part of some of the wellness tips that I will definitely share with them later. So good question, Alexis.
Thank you.
So I want to talk a little bit about barriers to treatment. So give me a reason why you think people would go for treatment. Any reasons that you can think of?
Why they wouldn't go for treatment?
Would not,
Maybe because sometimes our pride gets in the way. Misinformation is definitely one. Sometimes people sometimes they get their perceptions or their influence from their neighbors, their friends who may not necessarily be health experts, but something that they hear along the way and they feel that they need to pass along, even though it could be incorrect information.
Great, thank you. Want to weigh in, Alexis?
Maybe overall, like their comfort level, maybe they're not sure. Maybe they don't feel comfortable with their healthcare providers, or like Hector said, if someone told them something about a specific doctor or just healthcare providers overall, that may weigh in on how they feel about that.
Great. Nailed some of them. Thank you. So some reasons are people are in denial. And as you said, they could be embarrassed, they're ashamed, there's the stigma involved. I'm not going to a mental health, they're just going to say I'm crazy. Or sometimes people don't know where to go. And it could have the lack of money and or insurance. Other reasons, they're more likely to seek treatment from their primary care doctor instead of a mental health professional. And what I like to say is, you wouldn't go to your eye doctor for your feet, right? So why are you sitting up in your medical doctor who is not the mental health professional? That's where you need to be. Go to the person whose profession it is. Oftentimes, substance abuse is an issue in other medical conditions. So again, it's nice to check with your medical doctor to rule out any kind of medical thing going on, but also there are others to help you, mental health professionals. And again, I'll give you that toll-free number for the Mental Health Association before I end. And then oftentimes the people rely on their religious communities to deal with the emotional problem. But again, I've sat in church all my life, listening to clergy sometimes mess people up from the pulpit. Come fast and pray. Let me lay some hands on you. Read your word more. That's all right. But I have a theory. There's nothing wrong with a pill and a prayer. Take them both. That's what you need.
I like that. Pill and a prayer.
Others are fear. And as you said, a lack of knowledge of the treatment problem. Unfortunately, some people think, well, if I go, they're going to put me in a white jacket and stick me in a room. So other issues are location and hours of service. If you're not on the bus line and people can't drive, and the hours are not where they can get to before or after work, that's an issue. That's an issue. That's a barrier to getting your treatment. And here's one I hear all the time. Well, I have great friends, and family and supportive friends, so I don't need to talk to a professional. When you sitting there listening to your girl or your boy and they're more messed up than you are, really? Oh, okay, yeah, I said it. And if I seek mental health treatment, they're just going to give me some pills to take. Well, let me say, statistics show that how many times you went to the doctor, he gave you antibiotic, told you to stay on 7 days, 2 or 3 days later, you start feeling better and then you stop taking it. So don't use that as an excuse. So when we're talking about emotional wellness, these are the 8 dimensions. All of these things, just like those circles are intertwined, all of these things should be working together for you. So it should be your emotional, financial, social, spiritual, occupational, physical, intellectual, and environmental. Just as all of these are circling around each other, you should try to keep all of these on an even keel. All of these working together will help you to be as well as you can be.
Absolutely.
Okay? Keep in mind that geriatric specialists are specifically trained in the treatment of aging bodies. So you might want to ask for a geriatric specialist as opposed to a regular MD. A geriatric mental health professionals are a growing group of professionals with expertise in the identification and treatment of late life behavioral health issues. That's what they do. And older adults and their care partners should be encouraged to consult with geriatric mental health professionals. So if you or a loved one may be in need, you might want to suggest that there are geriatric specialists available. So having said all that, how to stay well? Well, one of the things is to be grateful. Yep, I said it, be grateful.
Yes. People
People who consciously count their blessings tend to be happier and less depressed. Gratitude practice is not only important for making you feel better psychologically during this crisis, it can help your physical health in response to respiratory infection and in general. Gratitude helps even if you don't share it, you just do it for yourself. Gratitude's benefits take time, so keep at it. And gratitude has lasting effects on the brain. And I'm sure you can at least come up with 3 things that you're grateful for, at least, if not.
Yeah, especially now during the pandemic, and we've seen how many people have lost their lives or have gotten the virus. So we could all be grateful that, for something at least.
That you woke up this morning. There you go.
Yes. Yes.
Okay. And then about taking care of yourself. Well, first of all, let me move the slide. Create a no list. We need to learn how to say no. Oftentimes we take on too much responsibility, then you have to discover why you're so tired and exhausted or just cranky because you took on too much without learn how to say no. And then take breaks. You deserve them. No matter what line of work you're in, if you're not working, or just whatever you're doing, take a break. Check in with yourself. How are you really doing? And be kind to yourself. And if you always try to squeeze in at least one fun activity that you enjoy doing. And then if you can't spend time with your loved ones personally, get on Zoom, make a telephone call. Make sure you lean on others for support. That's what they're there for. Unfortunately, we try to do it all ourselves. We're not always superheroes. So again, lean on others to help you with your needs.
Ms. Williams, would you mind providing us with an example of a fun activity that I see there? I do one at least fun activity that our seniors could participate in?
Sure. If you're able, go out and take a walk. That's free. The air is good for you. You probably need some vitamin D, or volunteering. Volunteering takes you out of your own headspace to help someone else.
Yes.
Or you can journal, write down your thoughts, and then, a couple of months back, you can look back and say, oh, that's why I was feeling that way. Okay. And then think about, how did you get past it? You did something to get through it because you're still here. So if you wrote it down, you may not remember when you're not feeling so great, but you can go back in your journaling and say, you know what? When I was feeling this way a few months ago, or maybe last year, this is what I did to pull myself up. So those are just some of the activities that people can do. Or listen to inspirational music.
Yes.
So there are plenty of things that you can do that would not probably cost you anything.
Of course.
But again, you have to just make a journal of what it is. What do you look like when you're well? What does that look like? So that you can go back, and if you look at it and say, I haven't been doing X, Y, and Z. For example, maybe you need to be up every day at 7 o'clock to do what you need to do, all right? Or maybe you need to get a good night's sleep. Or maybe you need to make sure you have healthy meals as opposed to snacking on processed foods that are not good for you. There are a lot of things you can do to stay well and take care of yourself.
Absolutely.
And so for my final slide, ladies and gentlemen, I wanted to read this airplane instructions for life. Now, airplane instructions tell you that when you're on an airplane, they'll tell you that if you are traveling with a small child and the oxygen mask drops down, put the mask over your own mouth first. So if you think about it, think about how that, try to move the slide away, how this applies to life outside the airplane. You really can't take care of anyone else unless you are taking care of yourself first. So do that first before you try to reach out and help others. Be the healthiest you that you can be, and I'm sure you'll have a better life.
Yeah, that's so true. And love yourself.
I'll go back and I'll open for questions if you have any, Alexis and Hector. So again, COVID-19 vaccination information is available. All you need to do, you can call our phone assistants for this vaccine registration at 855-568-0545. And again, your mental health matters. So please visit the mhanj.org, our website, and then avail yourself of all of our free services, which are virtual groups, screenings, text lines. This is for persons 14 and older, and it's from 8 in the morning until 8 p.m. So ladies and gentlemen, I hope you walked away with something new that you didn't know before you watched this video. And take care of yourselves, stay well. And what I like to end every episode that I do on I Thankful Tuesdays, to let you know that I love you all. And guess what? There ain't nothing you can do about it.
I love that. I love that.
Thank you so much.
That's
Thank
great.
you so much, Miss Laverne.
Yes, I have a quick question. Okay, I'll say mine first, Alexis. So as you know, Ms. Williams, during the pandemic, and we were forced to quarantine and isolate for a few months, and for many people, in particular our seniors, that still goes on. Many of them have to isolate or quarantine because of the circumstances we're in, because they are one of the most vulnerable populations. So what advice would you say to our senior citizens about maybe when they do feel lonely, when they do feel like, that no one's there for them or nobody really cares, even though, we're still in a pandemic and we're not able to socialize like normally, but what advice would you give them?
The advice would be to call our helpline. That's what they're there for. To, maybe they can just talk about what they're feeling. We have a peer line as well. We have a peer line. These are persons who have a lived experience with mental illness that are trained to answer the phones, because oftentimes someone would like to speak to someone who's traveled that same journey. So if they're feeling low, if they're feeling depressed, and if they've already had a diagnosable emotional challenge, they can call. Once they call that helpline, they can put them over to the peer recovery warm line. And these are people, again, who have lived experience, who can tell them what they've done to be able to pull themselves out. So that number is crucial in many, many ways, if not for that person, but maybe for their loved one. 866-202-4357.
Thank you.
Alexis?
Yeah, so I did have a question as well, and I really appreciate how you correlated how relatability to experiences, and how everyone needs to know that you're not alone. There is always someone that can talk with you and that may be going through the same things that you're going through. So I just wanted to ask the question, what can communities do to make our senior residents feel more welcome, and that to let them know that we care about you?
There are a lot of senior programs out there available. So again, I think that if, particularly now when people may have more time on their hands than they've ever had before, to look up all these different organizations that are available. New Jersey has a wealth of them. But even just checking out the Office on Aging and see what they provide and see where they can be helpful. Sometimes people volunteer to deliver food for mobile meals. So again, I'm not the expert on everything that can be done, but if there is information out there, and if you can Google, and most people have cell phones, most people have a computer, a lot of people anyway. And if you have grandchildren who are able to help you navigate through some of these systems that are a little difficult, definitely seek what's available. I would even start with the Office on Aging.
Yes.
What is available?
Yes, there are many. Go ahead, Alexis.
Sorry about that. Did you have a statement, Hector?
No, I was gonna just add that there are many resources out there. It's about providing that information or passing that information along to your neighbors, the lady down the streets, your family members, so that way they all are informed as well.
But also not only reaching out when you need help, but reach out to someone else. You could be a valuable resource to someone. You never know what someone's going through. Everybody sometimes will walk around with their game face, and you don't know what's underneath that game face. So perhaps just maybe a phone call and say, hey, I was thinking about you today. Just something that kind could brighten someone's day. So keep that in mind.
Absolutely. Absolutely. So I definitely just wanted to get into our closing remarks, and I just wanted to lastly ask you, did you have any words of inspiration or just a message that you wanted to leave us off with today?
Your favorite quote would be nice as well.
All right. Well, I like, do not get weary in well doing, because in due season you will reap and not faint. Which actually means, and I know some of you get it, you're not going to get to that due season if you don't do it. So do not get weary. Don't get tired. Keep it going, because even if you're talking to someone who has some emotional challenges, and you may think to yourself, oh my gosh, I just can't say anymore. I've told them 1,000,000 times. Well, maybe the 1,000,001 time that you tell them is that when they'll hear it. So don't get weary in well doing. Do the best you can, as much as you can, as often as you can, because you will not get to the other side unless you just stay the course.
Of course. Yes,
that was beautiful.
I love that. Thank you. We really appreciate that. And we want to let our audience know that ADAPT is here with you. We stand in solidarity with you. Miss Williams is here as well. She's a great resource in the community. So from now, we're going to turn it over to Miss Eileen Fishman, who is our next speaker. So thank you, Ms. Williams, for your participation.
Thank you so much, Ms. Williams.
So we're going to turn it over now to Ms. Fishman. So Ms. Fishman is the Director of the Essex County Community Health Services and the Director of the Office of Addiction Services for Essex County as well. She is an alcohol coordinator, in which she previously has taught young people and senior citizens about the dangers of drug abuse and use. She is a lifelong New Jersey resident and is also a registered pharmacist. So Ms. Fishman, thank you so much for being with us here today. I know you have more experience that you might want to add as well. So, Ms. Fishman.
Well, as you said, I thank you very much. I'm happy to be here. As you said, I am a pharmacist. I practiced for about 35 years. And in the latter part of my career, I came to Essex County as their senior pharmacist. I worked at their hospital center, which is a hospital for the chronically mentally ill, for about 2 years. And then I was promoted to this position, first deputy director and currently director of Division of Community Health Services. Community Health Services, just so you know, covers a broad span of many areas that help the residents of Essex County. For instance, early intervention, which would be for young children 0 to 3 with disabilities, cognitive or physical. It also does help seniors or people with physical disabilities 18 to 70 years old. So we run the gamut. We also do alcohol and addiction services, which is a big part of our role in what we do. And I always say we work here to save lives every day. And that's our job, plain and simple.
Of course.
Thank you so much.
Thank you. We really appreciate that. And since you know this workshop is specifically, it's for everyone, but in particular for our senior citizens who are one of the most vulnerable populations. And particularly now and even after the pandemic, many of our senior citizens have faced issues of mental health and physical health and emotional health during the pandemic, and even as the pandemic continues even though there is a vaccination that is being rolled out in a very timely manner, we still have to make sure that our seniors are still taken care of and that their mental health is being addressed. So I'll begin with the first question. So from your expertise, from your observations even, how can you, or what can you tell us per se about how mental health has been tested, in particular in our senior citizens because of the pandemic?
Well, everybody's been tested because of the pandemic, but I think particularly senior citizens because in their case, or even I'm a member of that group now, and so even in my case, you're limited maybe with your exposure. You're limited in, some people are limited physically in how they can get around. Some people are limited because of, they may have a particular problem or disease state that they need to care for, and they can't be out and about or as physically able as they once were. So as people, and this weighs on your mental health. And so good mental health is important to everyone, but because of how our lives change when we age, it is especially important for senior citizens. Staying vital and connected can help you ward off the depression that often comes with aging. So they say a challenged brain is a healthy brain. So it's important for us to keep our brains stimulated, either
Absolutely.
through exercise or reading or whatever, so that we can keep our minds off maybe ourselves or problems we once had or things we're experiencing. So we don't allow our minds to take over, right? The brain is a very powerful organ in the body. And so if we keep our minds focused on other things and connections to other people, we have a better chance of not being depressed. Depression is a very big part of aging, unfortunately. And but under this pandemic challenge, these feelings have skyrocketed. And so those of us who are of the interesting age, as I like to call it, may find ourselves segregated, isolated, quarantined, and feeling depressed. And, it's all of us at this point. Few of us have family close by anymore, so we don't have that human connection on a regular basis. And with the pandemic, it's much harder because everybody stayed by themselves and continues to stay pretty much by themselves. Some of us have a family pod so that we can see our children regularly, we feel safe in that. But many of us are completely alone because our kids are out of state or even out of town and really can't travel.
Yeah.
So just, I wanted to add a little bit to that. I know that you mentioned about seniors can partake in reading and exercising, but did you have any activities, any other activities that you wanted to elaborate on, just for seniors to make sure that their minds are staying healthy? I know we mentioned before about yoga or practicing meditation, things that would bring us peace. So did you have any more activities to add?
Well, I think that anything you can do to keep your mind active. So if you get a newspaper, in the newspaper, there's a section that has a puzzle, right? There's Sudoku,
Sudoku, yep.
right?
Yes.
There are crossword puzzles. Those things just in a newspaper. Beyond that, you can get yourself a puzzle book and do crossword puzzles, a jigsaw puzzle.
Right.
Right?
Yes.
You can start with a 24 piece like the little kids do if you haven't done one in a while, and then expand it. I have friends who have done, since the pandemic began, a number of 1,000-piece puzzles. I personally don't have the patience for that, but these people do, and it's very satisfying to them, and it keeps their mind active, right? So
Yeah.
it's you know, you can just read anything. It can be a magazine, it can be a recipe book. I bake and I cook, and so recipes are a good thing for me to read. And in addition to that, when I do that, I'm very relaxed and otherwise focused. So I'm not focusing on the fact that I haven't seen my kids in a year.
Right.
Gotcha. So for those seniors out there who, you know, how we talked a little bit about how depression, you know, a little bit about how depression hits when you get older. What about for those seniors who need that little extra push or to feel empowered to be able to do some of these activities? Because, you know, when depression hits or when you feel some of the signs of depression, you sometimes lose the will to do anything, or, you know, you lose
Motivation.
the motivation.
Right. Some people don't even know they're depressed, right?
Mhm.
They may feel tired. They may want to sleep all the time.
Right.
They may feel that they don't want to eat, and so there's weight loss. They may feel that they're not, you know, they can't function well, and so maybe that's due to their arthritis because they have inflammation and their hands don't work as well, and, you know, they can't get around as easily as they once did.
Mhm.
So in cases like that, you really should be calling the doctor. If you
Right.
think you have a problem, even if you think what I frequently call a general malaise, you know, you just get up, you're just not feeling right. You should call the doctor. You should have this discussion with them over the phone. If you're not capable of doing telehealth, which is a very big thing now because of the isolation and the quarantining for the pandemic. If you don't have that capability to do that, you can still pick up the phone and make the phone call, and you know, make sure you're taking the medications you're supposed to be taking. And if the doctor feels that something needs to be added to pick you up or make you more focused or make you feel a little better about yourself, then they will prescribe that for you. But the other things are really just trying to do things that maybe will connect you, right? Sometimes it's just enough to go outside and sit on your porch and just feel the fresh air on your face.
Right.
And if you live in an apartment building, sometimes it's okay to open the window just to get that fresh air in. Sometimes it's okay just to get on the elevator and go out front and walk around your building, you know. So there are lots of simple things that people can do to keep physically active. And then, of course, the more oxygen to the brain, I think the better off we are, and a lot of times the happier we are. So
Yeah.
Definitely through exercising, you know, or making sure that we're staying active. I just really wanted to stress that, you know, how our communities kind of interact with their surroundings definitely plays a role on their mental health as well. Just, I wanted to add just a little bit. So as a community, what can we do to support our older adults, and how can we make them feel more included so that they don't feel due to the pandemic that they are forgotten or anything, because they are not.
Yeah, I find this personally, this is my personal opinion, that there is a disconnect in the United States, actually, in our culture. When people get to a certain age, they should be put out to pasture. So I think that's the first issue that I see, right? You reach the age of 65 and really are not capable of doing anything much anymore. Meanwhile, people can work into their 90s and be very active and vital.
Absolutely.
And offer some really good expertise, information, support for a younger generation coming up. Many cultures have this where they build on to their homes so that they can keep their elderly family with them, so that the children, the youngest children, can have the benefit of the dimension of the elder, right? So we don't necessarily do that in the United States. I mean, I think we find it more now as other cultures have come in and they've taught that to us. But it's important to realize, I don't want to use, I guess, importance or the value that we bring as senior citizens in many respects, even if it's just teaching a family recipe to a young person so that the tradition carries on. If it's doing a specific tradition that we do at a holiday time, that you want to carry on, that's a tradition in your family. There are many things that we as seniors have to offer society as a whole. What can the community do? The community can do a lot of things. First of all, we can knock on the door of our neighbor and just check in. Just, you know, Mrs. Jones, how are you today? You know, that kind of thing. We're just checking in. We can keep socially distanced. We can wear our masks, right? But we can still have a conversation and make people feel wanted. So, or thought about. So I think that's a very simple piece. If we don't want to go there, we can pick up the phone and make the phone call. If somebody is tech savvy, everybody has a cell phone today. If they don't have a flip phone and they're tech savvy in a certain way, you can FaceTime, right? Look, my husband had a flip phone not so long ago, so I relate to this. But you can FaceTime. And a lot of times, because we're human beings, we need that personal connection. So it's nicer for us to see a face while we're talking to them, particularly if we haven't seen the face in a while, right? So I think those things are important. When we reopen the spaces, let's say we live in a senior building. When we reopen the spaces in the senior building, we should make sure that those spaces are continuously sanitized and that programs are done to engage people to a certain level where they don't need to be together, but they are engaged either mindfully by, you can do yoga, you can do simple Tai Chi, you can do just deep breathing. Those things are very easily done or chair exercises, or even chair yoga for those people who physically can't do regular yoga, even at a beginner stage. So there are lots of things to do. You can plan events in that environment that people can engage in and feel a part of something bigger. And then they know they're going home and shutting the door and going to be alone, many of them, but they've still had an exhilarating, mindful experience or exhilarating experience just by being out that day. So, and of course, if you're vaccinated, and many of us are now, if you're vaccinated, you can have a different type of experience because you can get together with people in a closer way, on a more regular basis, as long as they too have been vaccinated.
So I wanted to ask you a question, just to piggyback of what you just mentioned. So I wanted to know, do you feel that after everyone's vaccinated and everything, do you feel that the world would go back to normal? Or do you feel that because of everything that's happened, that a major source of fear has been instilled in our senior population specifically?
I think everybody is, quote, everybody is waiting for the day to get back to normal. But the normal will not be the normal we knew a year and a half ago, right? It will be different. We will approach it differently. And depending on your mindset prior to the pandemic could put you in a different space post-pandemic, okay? So, and we need to be, this pandemic, this coronavirus has taught us to be very cautious. We need to be very cautious. It's also taught us that whatever we do impacts others around us, right? Because this is an airborne virus, different than most other viruses we know of. And so if we respond badly by doing things we shouldn't be doing, like not wearing a mask and not washing our hands and not keeping socially distant, we're now going to impact all of those around us, and let's say at least 30 feet around us, right? Okay.
Yeah.
So if we take those lessons, and now we have to take those lessons because it's being said by scientists that in the next, we're going to be seeing more coronaviruses in a much shorter period of time. So the last major virus we saw was, or pandemic, was 1918, Spanish flu 1918, that's 100 years ago. Now we're going to begin to see them every 10 to 20 years. Maybe not as seriously as this, but certainly impactful. So we all have to pay attention and do the right thing. Will seniors be scared? I think I would like to put it in a way that they'll be much more cautious and conscientious. And I think all across the age groups, we need to do that.
Okay, so going off of that, it's interesting because even though, you know, as our seniors continue to age, sometimes the family members or those around them, sometimes they think that they know what's best for the senior within the family or the senior citizen community. But how important do you think it is that we actually listen carefully to what our seniors are saying and, you know, what they want and what they feel is best for them?
I think that you need to listen very carefully. I think that there is a part of being a senior where you get to a certain point in your life and you're very concerned about losing your independence. And so let's say that means I can no longer drive. That's a major piece of independence that I'm now losing, right? But also, I think you really need to hear what they have to say about how they're feeling about that and how they're going, how they need to do things to adjust to what that new normal is, if in fact it's no longer driving. Or maybe they can no longer stay in the house they were in for 50 years, be it for money reasons or because they just physically can't do it anymore. And so now they're going into a different residential setting. It could be living with a family member, which is one certain scenario, which could bring up all sorts of things. Or they could be in an assisted living situation, right? Or they could actually end up in a nursing facility where they need long-term care. So each piece of this, and even when somebody is aging in place, where they go from independent to assisted to long-term care, at each stage, you need to consciously move into that. You need to have not necessarily a psychiatric, but a psychological eval or conversation with your loved ones or your medical people or your social worker for that matter, to make sure that you're getting what you feel you need. But you have to feel like what you're saying is being heard. Because just because you're 85 and let's say in a wheelchair doesn't mean you've lost your mind. You know, I mean, you have to be respected. And I think you really need to be heard. I think listening is a very big piece. It's a very big piece to listen to children,
Yes.
because
It definitely is.
they can teach us a lot. I learned a lot from my kids parenting my children, so I know. So, you know, and I'm learning a lot from my grandchildren, a whole other generation.
Yeah, and I always encourage young people too, especially if they have grandparents who are still living, to listen to what they're saying, some of the generational knowledge that they're passing down, because
An experience.
the experience, that wisdom that they're passing down too, but also for the young people to at least stay up to date with what's going on health-wise, mentally, emotionally with their senior citizens as well.
Yeah, the dynamic is great. The generational dynamic is unbelievable. What you can give to your grandkids and what they can give to you is a wonderful thing.
Yes, yes.
Absolutely.
That's just,
So I just wanted to have our closing remarks, and I wanted to ask you, Ms. Fishman, did you have any words of inspiration or any more knowledge that you can share with everyone?
I have some very sound kinds of things that I wanted to leave them with some advice of what they could do if they were experiencing a problem, where they could call, give them phone numbers if that's okay.
Yeah, absolutely.
Okay, so I would just like to say that we have been put back to a time where we've always been very busy. This country has always been very busy. If we live on the East Coast or the West Coast, we're running to do better, to make more money, to get more things. And since the pandemic, it sort of taught us how little we really need, right? How simple we can live and how we can exist comfortably in that simplicity. So there's a saying that says, stop and smell the roses, right? Why don't you stop and smell the roses? And with this pandemic, that's really shown us that we need to do that. So even with all the suggestions I've made about things that you can do, like we talked about games and things like that, yoga, I think that it's important to know certain things that the county has to offer for seniors. So the first thing is we have a senior services division that you can call if you are in need of meals, suggestions of specific programs, transportation, or a certain type of care that you may not have now, but you can get through senior services. So for this, you can call the number 973-395-8375. Also, if you're having a problem with substance abuse, and that's a major problem now, along with mental health issues. Many problems with substance abuse co-occur with mental health issues. And so we have to look at both things, right? And analyze what the cause is. So if you have a problem with substance abuse and you'd like to reach out for help, or you feel you're ready to get some help, you can call our Office of Alcohol and Addiction Services, and that's 973-395-8147 or 973-395-8402, and we will help you to get services for that. Lastly, if you're experiencing what you consider to be a crisis and you need to talk to someone immediately, you call 211. And they will connect you right away with someone who can help.
okay. And I also wanted to ask you one last thing, since I know the DA Take Back Day is actually coming up. And as we mentioned at the beginning of the program, it is important that, you know, not just our seniors, but everyone take advantage and dispose of their medication properly. So do you have any, you know, words that you would like to add about the DA Take Back Day and the importance of the DA Take Back Day?
Well, if you talk to people in the DEA or surveys that have been done or data that's been collected about people who are substance users or abusers, it is said that many of them started their journey with substance abuse from the medicine cabinets of their family home or their grandparents' home. With that in mind, we need to know that outdated medications are not good for us. They're not good for us because they could have lost potency. They're not good for us because when they broke down in a certain chemical way, if we take them, they could cause physical harm to us. So what we want to do is we want to go through the medicine chest and any of the cabinets where we have pills hanging around, and we want to check the dates on those. We then may, if we don't ever want to flush them, we don't ever want to throw them in the garbage. Most people make coffee. So we want to take the wet coffee grounds, want to throw them in a bag or a can, want to take all those pills, throw them in the wet coffee grounds and mix them up. And then we can dispose of them confidently into the garbage, because nobody would go to try to take those out of the garbage, okay? And then they'll be incinerated. Our other option is to collect them, and then on a day like a take back day, which this year is April 24th, thank you. We can, if we have the ability to, go to the drop boxes we have throughout Essex County now, because ADAPT has been so wonderful in managing that process. There you go. And they're usually in a police station, but there are other places as well, but usually in a police station. And just about every town has one now. We have 22 towns in Essex County, and I think 19 or 20 of them now have a drop box for our use, our convenience. And we should be taking all those meds to the drop box. And the only thing I would say about that is first take the labels off the bottles, and then everything is anonymous. It doesn't matter. You cannot take liquids. You cannot take needles or injectables. If you have needles or injectables, what you need to do with those is pack them up and bring them to a hospital. And the hospitals will take those and bring them to a special place that they bring their other syringes to, and they will destroy them there.
That's important that we take advantage of this opportunity. So the DA Take Back Day again for our audience members is April 24th. You can find your nearest drop-off location on the ADAPT website, which is essexadapt.org. You can also give us a like on Instagram, which is essex.adapt. Follow us on Facebook at EssexAdapt. And please also, hopefully, if you enjoy this program, you can also tune into our upcoming WISE program, which Alexis will explain again what the WISE program is.
Hello again, everyone. So the WISE program is our 6-week, it's going to be a 6-week curriculum. And so we're going to also offer it, like I said before, we're going to offer it in English and Spanish. It's going to start the 2nd week of May. So a little bit about the WISE program once more. We're just going to be talking about substance abuse, aging, health, etc. And so we're going to offer our WISE program virtually, of course. It's going to be on May 10th, 1 to 2 p.m. And that session will be in Spanish. And then our second session that will be in English, it'll be offered May 12th, 1 to 2 p.m. So look out for that, everyone.
And look out for the flyer. And there's also going to be free giveaways too. So make sure you participate, because who doesn't love free giveaways?
Great.
Yes. So thank you so much to Ms. Fishman and Ms. Williams for participating in this mental health workshop. We really appreciate this. Don't forget, next month is Mental Health Awareness Month. So please continue to look out for more workshops from other organizations that are doing work around mental health. It is important that this information gets passed along to your neighbor, your friends, to younger people, so that we're all, collectively understanding about the importance of mental health. You could, if you would like to reach us directly, my email is hperez@familyconnections.org. Alexis?
And my email is araymond@familyconnectionsnj.org.
Thank you so much. Again, this program is brought to you by the ADAPT Coalition. We are under Family Connections, and we hope that you enjoyed this program. Thank you so much, Ms. Fishman. Really appreciate
Thank you, Ms. Fishman.
Thank you. It was good to see you.